If your fibroid is kind of more than 5-6 centimeters in size, it's not going to go away. You will require a surgery at some point of time.
How do women get these fibroids?
So it's basically, to a large extent, it's a genetic predisposition. But if you have multiple fibroids coming out from all sides, that is definitely going to distort the uterus and may have an effect on fertility. And then after the delivery, we usually say wait for about 6 months because the fibroid will shrink back to its original size. So that can happen because the estrogen stimulation has gone down. So if you think that your tummy is getting bigger, please get an ultrasound done and then decide if everything is normal that it's fat.
Correct.
So don't decide that it's not fat.
Hello everybody, welcome to another episode of Womanaari. We are here to discuss everything about women health, mental health, physical health. Today I'm going to be talking about a topic that is so much hidden under the wraps. It doesn't really come up and many of us don't know about it. Many of us must have seen people going through this, but we don't really know what, how, when, where it happens and how to tackle it. So today we're going to be talking about fibroids, and to discuss that in detail, we have with us Dr. Usha Kiran, who is a consultant gynecologist and a fibroids expert. Welcome to the show, Dr. Usha. How are you?
Thank you, Diksha. I'm good.
So Dr. Usha, we are here to talk about fibroids. Can you tell me, first let's understand what are fibroids? What's the condition? What happens in this place?
Okay, fibroids are basically tumors of the muscle of the uterus. The uterus has got inner lining, a muscle, and then it's like a soft muscle, and then an outer lining. And these are the tumors which are arising from the muscle of the uterus. When I say tumors, they are not cancerous. 99.9% they are not cancerous. So they are benign tumors, we call them. They are harmless tumors of the muscle of the uterus.
And how does one get to know that they have fibroids?
Surprisingly, many times people don't realize they have fibroids because they may not cause any symptoms. And if you scanned about 100 women, you'll probably find 50 of them had fibroids and they hardly had any symptoms. So they are that common. And if they are very small and if they are not located in a place where they can cause symptoms, patients might not realize at all. Yes, when they start having heavy bleeding, sometimes it could be due to fibroids. Sometimes they can sense a feeling of something, heavy in the tummy, or they can even actually feel something hard in the tummy. So those kind of cases, then patients come to us and then we do an ultrasound and then we detect it. But many times patients, I've had patients coming up to a fibroid growing up till their chest almost, and they were thinking that it was just gaining weight.
Are you serious?
It can
that
happen.
That's quite surprising for me. Usually what I have heard is when people have extra or excess menstrual pain, then they start to feel that, then there's something wrong. Is that right? Do fibroids cause
one of
pain?
the symptoms. One of the symptoms. If the fibroids are very small, they don't cause any problems at all. Sometimes even the large ones, if they're growing outwardly in the uterus, they don't cause much problems because there's a lot of space in the abdomen which can kind of take the fibroid. But if they're even if they're very small, if they're growing into the cavity of the uterus from where the period kind of comes, they can actually cause very, very severe pain, even if they're about 1 centimeter. And the ones which are growing outward, they can grow up till 15 centimeters without causing any problems.
Are you serious? My goodness, that is too much. 15 centimeters, that's a lot. So let's try and also understand. You said when the fibroids are really small, they're harmless.
Yeah.
Okay. But then the fibroids keep growing, and because you said that maybe 50 in 100 women have fibroids.
Yeah.
At what point do you get to know that now this is harmful and maybe I should go and see a doctor?
Okay, so the traditional thinking was that even if the patient had a huge fibroid and the doctors detected it, I wouldn't say others, even I would, like 10 years back, I would say, okay, fine, you're not having any symptoms, we don't really need to remove them, just, we'll keep monitoring it, okay? And only if they start causing symptoms like pressure symptoms or pressing on your bowel or bladder or heavy bleeding, painful bleeding, then we'll go and remove them. However, in the last 10 years, since I kind of specialize in fibroids and I see So many cases of fibroids, and so many number of fibroids in one particular patient. I've removed about 168 fibroids in one single person. And last week we removed a 1.2 kg fibroid laparoscopically in a woman, keeping the uterus intact. So I've seen all kinds of fibroids arising, numbers and locations and symptoms. You just name it and I've seen them all now. So based on my own experience, not based on what I would advise 10 years back, now I've started advising the patients. If your fibroid is kind of more than 5-6 centimeters in size, it's not going to go away. You will require a surgery at some point of time. Unless you are like coming up to menopause, then maybe we can wait and watch. Otherwise, even if it's not causing you symptoms, maybe a good idea to start thinking about removing it. I'm not saying you get it done now and it's urgent. But put the thought in your mind that you can plan this surgery and get away with doing it now rather than leaving it to become 10 centimeters, 20 centimeters. Because at some point it will require removal. The bigger the fibroid, the more complicated the surgery gets, more blood loss, more pain, longer recovery. So based on these factors that I have started noticing, I tell my patients once after 5-6 centimeters, I say, just have a think about it and let me know. Maybe in 6 months, maybe in 1 year, maybe in 2 years, but try and get them
Check
out.
Yeah. Makes sense. And can you tell me, how do these fibroids develop? I mean, are there any dietary restrictions or any particular things that people eat or consume, or is it a lifestyle? How do women get these fibroids?
I would say partly yes and partly no regarding the lifestyle. The general consensus, what we so far studied and understood, was everybody has a uterus, all women have a uterus, all of them have the ovaries which are producing the hormones. Now, why does somebody get a fibroid, which is like overgrowth of the muscle of the uterus, and why somebody doesn't get? So it's basically, to a large extent, it's a genetic predisposition. So you might be more prone for fibroid and somebody might not be more prone for fibroid. However, added to that is the risk of the external factors nowadays, which is cropping up, is the increased weight. So fat in the body also produces estrogens. So any condition which is estrogen dominant or which thrives on the estrogen in the body is going to make it, fat is going to make it worse. So if you have a tendency to have a fibroid, I'm not saying just because you got fat you will get a fibroid.
Correct.
But if there is a small fibroid, the tendency of it growing bigger and getting multiple fibroids becomes more. So based on that, yes, keeping your weight down is the best thing that you can do, and to do that, obviously a healthy eating and exercise.
Correct. Let's also understand, are fibroids common in unmarried women or married women, or does it have nothing to do with your sex life or anything?
Sex life, no, it has nothing to do with the sex life, but childbearing, maybe there is some role. Okay. Now, reason being, there is a large amount of progesterone hormone which gets secreted in pregnancy, and after the pregnancy, if they're breastfeeding, there is no period for a long time. So there is some amount of estrogen is decreased. Although having said that, estrogen is also increased in pregnancy. So fibroids tend to grow bigger in pregnancy. But if a woman is having probably more children, because of there's no constant stimulation with the estrogen, there's a little break, there might be a little less possibility that they will develop less fibroids, or the fibroid tend to grow lesser. Maybe.
Wow.
But nothing to do with unmarried and married. It is more to do with the childbearing.
Childbearing, correct.
But we usually see them in women. Nowadays we see early, but we see them in the women around 25, 30, 35, 40. So below 25, I do see them, but rare.
It's rare. Okay. And I also want to know, do fibroids affect fertility?
Yes and no again. So if the fibroid is growing completely outward and not distorting the uterus or the uterine cavity, it may not have any effect on the fibroid. But if you have multiple fibroids coming out from all sides, that is definitely going to distort the uterus and may have an effect on fertility. If a fibroid is growing into the cavity of the uterus, the chances that it might have an effect on the fertility or miscarriages. But having said that, when somebody comes with fibroids to us and they're trying to conceive, we don't go ahead and first advise, oh, get this fibroid removed, you'll get pregnant. We generally say, get investigated, find out if there is any other cause for fertility. If there is nothing at all and they've been trying for a long time, then you say, okay, fine, let's get this fibroid out and see if this makes any difference. So with a pinch of salt, not really like, we can't.
It's like an absolute recommended thing, कि नहीं ये तो होगा ही होगा, इसका वैसा नहीं है.
So I've had patients who have had 7-8 fibroids who have got pregnant and delivered normally as well.
Right.
So it's not a mandatory thing कि fibroid है तो इसको निकालना ही पड़ेगा, नहीं तो pregnancy नहीं होगा, वैसा नहीं है.
Understandable. And what are the options for treatment that today women have who want to conceive? I mean, is surgery the only option available?
Again, surgery or no surgery depends upon the location of the fibroid. If the fibroid is coming into the cavity of the uterus, having a surgery, which is a very minimally invasive surgery, we put a telescope through the vagina into the uterus, everything from below, no scar, nothing, and we can remove the fibroid. That might actually help the patient. Now, if they have multiple fibroids in growing outwardly or in the muscle itself, those ones up till now, like if you had asked me 6 months back, I would have said the only way was surgical removal. Laparoscopically, I do them. But now in the last 3-4 months, I have introduced a new treatment. When I say I've introduced it in Dubai here in Prime Hospital. It's been done elsewhere in the world, like in Europe and America and India as well. It's the microwave ablation, which is the newest treatment. The best bit about the microwave ablation is that there is no scarring inside on the uterus. We do it laparoscopically. It can be done through just a transvaginal route also, but there's no scarring on the uterus. So we don't cut and remove the fibroid and stitch the uterus up. We just put in a needle and ablate the fibroid. The microwave energy shrinks the fibroid. So depending upon the location of the fibroid, the size of the fibroid, some women are much more suitable for the microwave ablation. Although it's not a permanent treatment like the surgical treatment where we take the fibroid out and it's gone. Okay. But in microwave ablation, it shrinks. The fibroid is still there. It might regrow again. But no scar on the uterus, which makes the fertility chances a little better for the patient.
Sure. And talking about shrinking, there's also something I read on Google, and I may be absolutely wrong, is that the fibroids shrink sometimes on their own in a woman's body.
Yes, it can happen. So, for example, if somebody had a fibroid, in pregnancy, the fibroid grows bigger. And then after the delivery, we usually say wait for about 6 months because the fibroid will shrink back to its original size. So that can happen because the estrogen stimulation has gone down. Similarly, if somebody is menopausal, there is a good possibility because it's not getting the estrogen to grow, the fibroid might gradually shrink. But this concept again has been kind of misinterpreted many times. I've had patients who are 52-year-old coming with a 10 centimeter fibroid, and somebody has told them, it's okay, you're menopausal, it will shrink. The 10 centimeters is not going to shrink.
Correct.
If it's about 3-4 centimeters, 5 centimeters, not symptomatic, yes, you can tell them, let's wait and see for about a year or so. But if it's 10 centimeter, no point trying and waiting on it.
And tell me, in terms of the surgery for this, because that is a permanent fix, as you mentioned, what are some of the risks associated with the surgery?
Any surgery, there are risks. I mean, I usually, when patients ask me, are there any risks, I say this to them. You get down from my OPD now and then get into the car and start driving, or your husband is driving. Can he guarantee that there is no risk? Okay. All he can guarantee is that I will drive safely, I will follow all the rules, and most likely will not end up with an accident. So similarly, every surgery has a risk. We are cutting tissues, we are giving you anesthesia, we are giving you medications. So chances are there is going to be possibility of bleeding, requiring blood transfusion, infection, depending upon your body's immunity, injury to the surrounding structures like bowel, bladder, in kidney tubes. So it depends on the case as well, how where the fibroid is located. So these are all inherent risks, but obviously the risks reduce with the experience of the skill of the surgeon. So 99% of the times patients go home with no problems. But 1% there is a possibility any of this can happen.
Something can happen, correct. You have a point. What are your top 3 symptoms that women should be I mean, when they get these symptoms, they should at least go and check whether they have fibroids or not.
Well, one of the things generally women tend to ignore is the tummy is getting bigger. Now, because in middle age, tummy is getting bigger because of the increased weight around, which is normally the case, but everything else they put it down to my tummy is getting bigger, maybe because of the weight gain. Okay. Now, that is one symptom most of the women ignore, and I don't want them to ignore.
Correct.
Because it could be a fibroid, that is still okay. It could be an ovarian tumor, which is not okay. So, if you think that your tummy is getting bigger, please get an ultrasound done and then decide if everything is normal that it's fat.
Correct.
So, don't decide that it's not fat.
Okay.
And again, menstrual problems. It could be due to fibroids, it could not be due to fibroids. Excessive menstruation, frequent menstruation needs to be investigated.
Frequent menstruation means, say, more than once in a month?
Yeah, more than once in a month.
Okay.
So, minimum you can have is every 21 days a period, which we still call it as normal.
Correct.
So, if somebody is having a period every 15 days, somebody is bleeding all the time in between, somebody is bleeding so much that they're losing hemoglobin, is dropping down, they're in a lot of pain, it needs to be investigated.
Okay, what else? So you've got about 2 things. Anything else?
Symptoms, people can have pressure symptoms. Sometimes they feel that something is pressing on the bladder, they're going to pass urine all the time, they have to rush to the toilet. Those kind of symptoms also could be due to fibroids.
Okay.
And one of the most important one, although is not a common symptom, is there is a sudden increase in the tummy growing bigger associated with pain.
Okay.
Fibroids, as I said, 99.9% don't turn into cancer.
Right.
However, when they turn into cancer, in those rare circumstances, they tend to grow quickly. In the sense, week by week, the patient is noticing a growth which is getting bigger, and there is a lot of pain. So these 2 symptoms, if somebody has a fibroid already, and if they're getting these 2 symptoms, they definitely need to seek medical advice.
My goodness. I think these are things that, we should generally be aware of. We tend to ignore these things,
Women tend to ignore a lot of symptoms.
Yeah.
That includes me as well.
That periods अगर ज़्यादा बार आगे को बात नहीं, एक बार है, doesn't matter, थोड़ा continue करेंगे तो फिर देखेंगे and all that.
Concept of the whole concept, cultural concept or whatever it is, is just women are trying to take care of other people around them, and majority of the times they are not taking care of themselves.
They ignore
this
themselves.
Is universal.
Yes.
Everywhere. So I feel women should first take care of themselves and then think of others. If you're good, you can look after other people. So that's
I like
most
this
important.
this thing that they tell us in the aeroplanes, that you first wear the oxygen mask on yourself, and then you help the other person. I think that is something that is so ignored. We're so busy looking into other things, and like अपना थोड़ा पेट दर्द तो कोई बात नहीं, पेट ही तो बढ़ गया है, क्या फर्क पड़ता है?
Exactly.
So we don't really take
and
care.
Also putting down all the symptoms as it could be due to this, it could be due to that. Okay, I'm not saying that every symptom you get, you end up in the hospital. But at least if a symptom is persisting for more than a week, I think you should seek medical help.
100%.
Investigate it. There's nothing, fine, you've not lost anything. You're safer.
Correct. And let's also talk about, how are there any medical, like in the sense, are there any emotional or any other issues that are related to fibroids that women after surgery should be prepared for? Ki once we get the surgery done, this is what can happen to us.
Well, the surgery recovery period itself, yes, we usually keep the patient in the hospital for 2 days, and after 2 days they go home. They don't have to lie down and take any bed rest. They can slowly move around, do most of the things themselves. The pain is there, but we give painkillers, so pain gets better every day. By end of 1 week, majority of the women, 70% of the pain is gone. By 2 weeks, they're fit to go back to work. So we actually give them a DHA sickness note for 2 weeks. Rarely, some patients might require another few days extra, but otherwise, majority of them, more than 98%, are fit to go back to work after 2 weeks. And the main thing that we tell them to avoid is heavy weight lifting for about 6 weeks. And no intercourse for about 6 weeks till the bleeding and everything is getting sorted out. But otherwise, it's not, especially when done laparoscopically, it is not a difficult surgery to recover from.
Correct. Very interesting. Well, thank you so much, doctor. We've got so many, interesting things to learn about fibroids. And if anyone who's watching this podcast ever feels that, there's heavy bleeding, or if you feel that, tummy is growing just, very unnaturally, and, your stomach pains, please go see a doctor, and go see Dr. Usha Kiran. Approach her, because, she said it out very rightly, and I also believe in it, that we ignore so many symptoms around. Our body keeps signaling us and telling us there's something wrong, and we're like, no, it's okay, we'll see. So don't wait for things to get worse. Sort it out at the earliest. Thank you so much, doctor, and we will see you all very soon with another interesting topic. Thank you, doctor.
Thank you.